COVID-19 has added a huge burden to the already struggling health system in the country. Public health is already battling other life-threatening illnesses. Resources are limited, skills are scarce, and infrastructure is lacking in many places. But some progress has been made in the fight against diseases like HIV, AIDS, malaria, and lifestyle illnesses such as diabetes. Now, at this time of the year as well, we experience an increase in road carnage, which also places extreme pressure on emergency wards. Academic and Reimagine SA's co-founder, Dr. Mamphela Rampili, is joining us now to discuss, for example, what should our national health priorities be into the future. Now, Dr. Rampili, thank you very much for your time. I'm just going to start by giving you a very brief context into why I wanted to speak to somebody like you this morning. I was looking at what's happening currently with COVID-19, all resources being marshaled globally, every country marshalling them in fighting this pandemic, which is the right thing to do. But looking at our other health challenges that we've had for decades, like HIV, AIDS, still with us, tuberculosis, and other illnesses, non-communicable diseases, like your lifestyle illnesses of diabetes. And I was thinking, how do you prioritize now as a country, from a policy level, going forward? What should the country's healthcare priorities be in this world post-COVID-19?
Good morning, and thank you very much, Dan, for inviting me. What we have now with COVID, it's simply the opening of our eyes to the inadequacies in our systems that have been with us since the dawn of democracy. What COVID does is to put the level of urgency to addressing those structural problems in our healthcare system. And as someone who used to be an activist working with poor communities, it actually doesn't take too much to have a reliable, accessible, and preventative and promotion of well-being focused healthcare system. So you could imagine that now that we have seen how inadequate our system is, the president has announced an infrastructure fund. I would suggest, first of all, the government should look very seriously at upgrading the infrastructure, particularly in those small town and rural communities where health facilities are shocking in some cases. But we also have a very strong academic health system. You see our professionals are able to compete with the best in the world. We've just seen one of us winning an award, which means we have the capacity to be able to do the right thing, but we have not marshaled that capacity into a well-structured healthcare system with a referral network from the primary to the tertiary. Second thing, we have huge unemployment. What's wrong with making sure that we get people trained to be health assistants? Because they can do quite a lot. We used to work with rural people, even those who were illiterate. They can be trained to do those jobs which relieve the professionals to do the more technical work. So I think COVID-19 is a wake-up call to get us to put more urgency in fixing the problems that have been with us for a long time, but that are offering us now an opportunity to turn them around into creating a sustainable healthcare system that promotes well-being. Because the diseases that we are talking about are diseases that are preventable, that are manageable in a healthcare system that's properly functioning.
Now, Dr. Rampili, you mentioned it's urgent. You've mentioned the structural issues with the system, but you are saying that we need to be upgrading infrastructure, we need to be training people. Do you believe with the limited resources at the disposal of the health department and other government departments that what you are talking about can be achieved within the next 5 years, for example?
Absolutely. We have a very strong private healthcare system. If we can have proper partnerships between the public and the private, we can overcome a lot of our problems. It is simply a question of leadership on the part of both the public sector and the private sector to look beyond the short term and look to the medium and long term. As I said earlier, we have a very sophisticated knowledge base, science base. There's no reason why we are struggling as we are right now. It's simply that we are not able to reimagine a healthcare system where the public and the private work in an integrated way, and we have seen glimpses of it.
Is that not what the government is trying to do with the NHI?
Yes, but the point is you don't just order from above. You also, as we saw at the beginning of this COVID, people were willing to volunteer, to collaborate. So you need to have a policy framework, but you need to inspire people to work together at the local level.
So there will be a need as well, then, in your view, to review the current health care and the national health policy framework to enable it or tweak it in a way that promotes that collaboration, that cooperation, and enables, with limited resources, the reprioritization of certain aspects of our health system.
Absolutely. But at the end of the day, it is not only policy. We are very good at policy, but the implementation requires a willingness of people to work together, a willingness to understand that together we can achieve much more than we can individually do when we are just looking at one another as competitors. We are interconnected, interdependent. That's what Ubuntu is about. We need to take that mental attitude into the work we do as professionals and as family and leaders at all levels.
Now, finally, Dr. Ramphele, when you observe what's currently happening with, of course, all the resources being correctly so, appropriately so channeled in fighting the pandemic, do you think from what you are seeing that we are getting the message as policymakers, as private healthcare practitioners, as a public healthcare practitioners, that COVID-19 is a wake-up call, and let's use it as an opportunity to change for the better into the future?
Absolutely, but we also need to root out corruption that always looks at emergency as an opportunity. That mindset, our president must root out of the public sector as well as the private sector, because as we have seen at the Zondo Commission, it's not just the public sector that's corrupt. The private sector is an enabler of corruption as well. So let us root out this corruption. It is stealing from the most needy amongst us, so that we can work together as a nation to build this beautiful country into one where everyone's well-being and dignity is respected.
Thank you very much, Dr. Mamphela Ramphele. We wish you a happy festive season, and please stay safe. Thanks for your time this morning on Today here on eNCA. Thank you very much, Dr. Mamphela Ramphele. And talking there about the urgency that is there now for us in this COVID-19 world to really review our healthcare system and fix certain things to make it more reliable and accessible, and upgrade infrastructure, especially in rural and small towns of our country. And what about training? There's huge unemployment, and she's suggesting we can train people who are unemployed, even if those who may not have matric, to be health assistants of sorts. Of course, when she was an activist in the 70s, she crisscrossed the country as an anti-apartheid activist, working as a doctor on the ground in rural South Africa. Now, still